Welcome to EnVision Center News, where we discuss community impact and involvement with today's nonprofit leaders and philanthropists.
Hello and welcome to the podcast. Excited to talk about your work in the nonprofit space, but let's start off at the beginning. Tell me a little bit about you before you were doing this work.
Okay. My name is Jennifer Whitmyer. I have been in senior living for the past 15 years. It's been just a whirlwind of love and connection and helping communities come together to support seniors and just taking care of each other. That's a little bit.
Was this kind of where you are now? You said you've been doing this for 15 years. Mm-hmm. So where you are now, is that have you been with this organization for that long?
So I'm at Luther Park in Sandpoint. We are a nonprofit senior living. I've been with them a little over a year, and it's just an amazing community for sure.
And what's your role there?
I'm the executive director.
Okay, so you've been there for a year. Are most kind of senior living places nonprofits?
Not all of them. You know, there's bigger corporations out there, such as the Brookdales and those larger communities. I think why ours is so special is because it is all about our community. It's taking care of who we are as Sandpoint residents.
Mm-hmm. And if someone's deciding whether they want to place themselves or a family member or something, they're looking for this kind of experience, what would be something that you'd say if they're determining whether to go with something larger mm-hmm. or more kind of community nonprofit, smaller?
I think it depends on the person, and what they're comfortable with and just, what they're looking for. Every place is different. What I can say from experience is I've ran, corporated communities and nonprofits. And my favorite thing about ours is that, it was brought over in 2008 from the First Lutheran Church, and their commitment to our community has just been astounding. They give back into the facility, and when you go to do a tour, you can see that just by walking in the doors. You can see the staff are happy and full of life. The residents are full of life. I always recommend, if you're going and touring, to go during a mealtime. It's just when you pop in different places, you can see what the food is like, and because that's the number one thing, we want to know what we're eating every day. And is the staff, are they feeling tugged? Can you see that tension? I just say just go around, check places out. It's definitely of what you are looking for.
And what draws you? I mean, you've kind of touched on it. You said the community aspect, but a lot of people would say that about I shouldn't say every, but most of the people that come in, whether they're leading a sports oriented mm-hmm. nonprofit or a nature one or a directly involving humans one, they'll talk about community a lot of the time. Yeah. So what is it specifically about dealing with this population, the elderly, and the work that goes around with it, our seniors, that makes it particularly special or maybe different than another nonprofit that also mm-hmm. does connection to the community, right. If that makes sense?
Yeah, absolutely. We have staff that have just been there for years and years. We've had residents that, we just lost somebody that was there for 13 years, another one that was there for 16 years. The longevity of the relationships that have been built in our building are extraordinary. And some of the First Lutheran Church members have also been a part of these residents' lives, growing up, because Sandpoint's a smaller town. And I think just the connection, the physical connection between families, in the community, our community of Luther Park, the church, the outside community, we've got people who their son is the doctor in the area, or, an attorney, and they love to come in and represent our community and what we do. So that's a big part of it.
What kind of clientele can you serve? Like, what level of assistance can you provide?
So we do everything. The only thing we do not do is memory care. We used to, but the need for more of an assisted living has become more prevalent in senior living. The rules and regulations have changed as well. So we're able to take on more heavier care. We're able to keep people in the continuum of care and let them be in their home as they pass. So, we have people who are only needing housekeeping just to come in because they don't do it safely at home, or residents that need full transfer assistance or medication management or reminders to meals or any of that. We do a wide variety.
Yeah, that sounds like that's so much schedule, like knowing every
It
single
is.
person's
It
like
is,
very
yeah.
detailed. That's a lot. I'm imagining some kind of, it's almost like the memes of somebody with all the
Yeah.
different data,
Yep.
they're like in the FBI. That's
Right?
kinda like
It
you.
feels
Okay,
like that
so-and-so
sometimes.
needs this. Yeah.
Yeah. We have 93 residents right now.
Wow.
We're capable for 110. And, we have an amazing system, wonderful nurses and clinical crew that really get to know. It's extraordinary to see how they are able to take, everybody's schedule and know what certain people like, know that she doesn't like her toast before 6 a.m. or
Wow.
whatever. They know it like the back of their hand. And it's incredible that they can continue down that to serve them.
Well, how many volunteers do you have? Do you have people coming in and volunteer? Whether it's I come in and I play my guitar or,
Oh, yeah.
things like that.
We have quite a few. We have some volunteers that are needing clinical hours, and so they'll come in and work alongside our clinical team or our activities. We have a piano player that's beautiful. He comes in twice a week and plays for residents. We have schools that come in and sing for the residents. We just have a lot of different avenues that they come in and do.
What would you say is your biggest need, if any, for volunteer?
Activities. You can never get enough volunteers for activities.
Like teaching a class or something?
Yeah.
Or doing what? Yeah.
Doing crafts,
Yeah.
whatever. Playing games, puzzles, anything. It's hard because not everybody wants to come out of their room for activities. And we have a robust activities schedule, but, some of them don't want to come out of their room because that's just their little home bodies. So if we could have somebody that does, one-on-one activities, and I'm going to go hang out with you and listen to your life story and do a puzzle with you. Those are my favorite moments, and those are the ones that are definitely needed.
Is it harder to get people? Do people generally want to do the activity to the big group, and they don't necessarily want the?
I think it's both, honestly.
Yeah. How do people reach out? Just show up and tell you, or is there a volunteer place on the website?
Yeah. So my email is on the website. It's jwhitmyer@lutherparksandpoint.org. And you can reach out and we can get you in. You have to go through the whole background check and all that good stuff. And we'll introduce you to our activities director or whatever
Wherever you want to, wherever you want to plug in. Because how else can people? Because of course, I think most children at some point have been transported to the the senior living place, and we're going to sing carols or do whatever. So that's the first thing that I thought of. It was more of like activities based stuff or performing. What are some other ways that people?
We have some veterans that come in to see our vets, and they just serve coffee in the morning and just chat. There's just hang out, talk, sit by the fire, visit, just hang out with them.
Yeah, there's probably not a bad idea, really, that if it's just about spending time in one way or another, that's what it all comes down to.
Yep.
Yeah. What about as far as funding, fundraisers, grants? Like, what's the main way that you, obviously, I'm assuming the clients pay
Yes.
into it. So maybe you don't need to do a lot of that extra stuff and that just pays for itself, or how does that work?
We do some fundraisers throughout the year. We do family meals that we open up to the public to be able to come in, and, we charge per plate, or donations are always a thing. Families that have been there a long time, they like to donate to our cause as well. But yeah, it does, the residents put into it and it goes right back into them. And the church donates a lot as well.
Yeah, that church partnership is really...
It's huge.
Yeah, that's huge. And that's not typical even of a nonprofit, right? To have like a church right there that's supporting.
Yeah, we're connected.
Yeah.
So we have like one hallway. So if any of the residents want to go to church on Sunday or want to go on any of the activities, there's a hallway for them to just stroll on through, so they don't have to go outside in the elements. And then, the pastor of the church, he'll go to anybody who wants to chat. He'll go to the room. It doesn't have to be Lutheran. It can be anything non-denominational.
Yeah.
I just want to make sure they're feeling it.
Yeah, yeah. Getting their spiritual needs met, for sure. You said you've been there for about a year?
Year and a half.
So,
yeah.
Do you have any, whenever someone comes in and you're still fairly new, I mean, you've been there for a while, but
Right.
you're still fairly new. Did you have any big kind of like vision ideas, like I want to change this, or in 5 years, this is where we're going to be, or, I want to see this program that you don't currently have?
We have started a lot of connections in the communities, such as we started a women in business that meets at the community once a month, being a part of different nonprofits and fundraisers and having the residents be a part of, and really taking more of the heavier care. That was one of my biggest wishes was, where are they going to go? There's nowhere to go anymore. They can't just go stay at a skilled facility because they want to get you better and send you home. So where's home?
Yeah.
Where are they going to go? And we want to be that place that, we can take care of you. Mm-hmm. Yes, your mom is on hospice and probably will pass pretty soon. And we want to be the one that's going to love on her and take care of her in a room-like setting so that she can pass in a home.
Yeah, yeah. What do you do, when you're kind of you experience or come close to death all the time in this kind of environment? How do you personally cope or manage that in something that can potentially feel heavy at times?
It does feel heavy, especially, they try to tell you when you're in training and all of that you have to have that fine line of closeness with your residents, and it's just impossible. We love them all. They all have something amazing that they bring forward. So some of them are a huge loss, and others you're just so grateful that you got to spend that time with them on their journey, and know that they're not in pain anymore. And we got to have fun during the last time of your life. I like to say that we're a senior living college. We're fun, we do fun stuff. Every Thursday we do Thirsty Thursday, and it's getting crowded in that room. They all want some wine or a special beverage or whatever. And, they're adults. They should be able to do what they want.
Oh, yeah.
So it is heavy. We do have grief support for our staff that we do. I think one of the hardest things is, just really bringing home to the staff that now we get to help someone else. We helped them along their journey, and it's hard. We need to mourn them and grieve them, but now we get to open the doors to help someone else.
Yeah.
And that's what we want. We want to be those people.
Yeah. Do you have a favorite story or stories of some kind of experience or difference that you, or maybe you saw a staffer make, where it's just like, you think of it still to this day, maybe it happened months ago, and it just brings a smile?
Yeah. We had, at one of my communities, we did, like a dress up spirit week, and it was dress like your favorite resident, like a twin day. And this gentleman, had just had neck surgery, and he had a collar, and he had a walker, and he was just very straight. And the nurse went and made a collar and had a matching shirt just like him, and they hung out, and he said, I want a picture. If I was going to twin with anybody in this world, at least I got a beautiful gal by my side. And it was so cute because they were literally the same. And it just brought a smile, you know, in a hard time when you don't feel yourself and you're kind of confined, to kind of give that little laugh and see the good on the other side was huge.
Yeah. That sounds cute. How can the community support you? I mean, obviously, somebody could make a donation, and if they have, you know, an idea for an activity or whatever, they could do that. But are there any other ways for the kind of the, I don't know, like the passive supporter who isn't going to write the checks and isn't going to come in and play piano, but they just think this is important that they exist and the services that they provide?
I think just helping us spread the word, you know, that we're here.
Is there typically a waiting list, or do
we
you
do?
not? You do. Yeah.
We do have a waiting list. We have 11 designs of our 1-bedrooms, and so there's certain designs that, you know, for instance, let's just say the C package. They want that special package, so we're going to be on a wait list because it's very popular.
Okay.
2 bedrooms are our wait list for sure. We are pretty full, and we're getting more and more occupied. But yeah, just, you know, we do, like, we're going to be doing a huge Easter egg hunt for the public. And they can come in, and we'll have Easter bunnies and cupcakes and cookies, and bring your kids. And I think that's a big part too, is to just come celebrate those little wins with our residents, because they love it.
Yeah.
They just love to see everybody. But yeah, we have a Facebook page. You can follow
share,
along, watch what we're doing, share. Just come check us out. Come have lunch.
Do people have to like sign up for that, or how does that work?
Just call and let us know.
Just call, and they don't have to do the background check or anything.
If they're just like coming in to see, they'll meet with Dawn, our director of marketing, and, you know, they can just come chat it up.
Yeah. I think a lot of people don't realize how easy it is. I didn't realize how easy it is that I can just kind of give a call.
It really makes your heart happy, honestly. I come from a law enforcement family and worked corrections for many years, and so my background is kind of the ugly side. And as soon as I got into senior living, it was like, holy cow, like this is what I needed. This is beautiful. And to hear all the stories and the wonderful people and the things that you're like, oh my gosh, you know, this is a dying breed that should be celebrated. We're so lucky to be able to hear these stories.
Yeah. How did you switch from corrections?
I know,
to
it's
senior
weird.
living? You opened that can of worms.
I know, sorry.
No, but I'm curious now.
My uncle was diagnosed with Alzheimer's in 2010, and I helped take care of him. He started to become unsafe for the home. Police officers found him on a side street, and they were trying to help him. And he said he was looking for the Coronado Bridge. We're from California. And so they kind of knew that he was maybe a little confused. So we went looking for facilities, and we searched high and low. We looked 9 different memory cares, and finally found one. And I couldn't stand being away from him. I was working on, going to work at the prison in Spokane, and I hated being away from him. So I just went in and said, I've never done this before. I've never done caregiving. Yeah. I want to try it. I've taken care of him, so I feel like I can do something. And that was it. Writing was on the wall. I fell in love.
Yeah. And so, did you work at the place that he was at? Okay. So then you did that there. Okay.
Yeah. I got to go work there and have the pleasure of being with him through his whole journey, long journey.
Did he understand what was going on when you started working there? Was he cognizant enough to know?
Yes and no. I mean, he knew that he belonged to me, but my daughter also worked there. And I think
She followed your lead and said, I'm going to do it too.
Yep.
That's so cool.
She was a hospice CNA. She was amazing. She is amazing.
Does she work with you now?
No. She's got 4 babies. She's a stay-at-home mama.
Okay.
My son also started and worked in the kitchen. My whole family's been in senior living ever since I started. So it's just, we hang out there. It's a cool place to be.
Yeah.
It's where all the cool kids are.
Yeah.
But my daughter, she's blonde and younger, and I think he connected with her so much because he thought it was me at a younger version. But he knew that I belonged. He just didn't understand the age.
Yeah.
It didn't make sense to him at all.
Yeah. Well, at least he had some kind of safety blanket, even if he didn't quite understand that connection. I had another question at the tip of my brain. Oh, what do you think is the most kind of misunderstood thing about senior living or facilities?
There's so many.
Yeah, I'm sure there's a long list.
Again, I go back to my uncle. When we were looking for memory care, my family, the old way of thinking is they're nursing homes, right? And when you had mental incapacities, it used to be that there was shock therapy and, they would try and do all of these unheard of measures. And so that was the thought of that's where we were taking him. And it's so far from that. Just getting rid of that stigma of assisted livings being a nursing home, because we're not. We are fun. It's different. Nursing homes are no longer really a thing. It's a way of life. And it's home. We want it to be home, not sterile hospital feeling, because nobody heals in that.
No. Yeah. So it's not just that you're not a nursing home. It's that, like you said, nursing homes don't really, everyone's moved to this kind of new model of trying to be, like you said, a college kind of fun atmosphere for seniors.
Absolutely.
Yeah. Where it feels like home.
It does. That's for sure.
Well, that's awesome. Let's see. I don't know. What else did we maybe not cover that you want to make sure our audience knows about?
I think we covered a lot.
Yeah. I mean, people know now how they can get involved, how they can reach out and connect, kind of the different ways that you fundraise, that there's events that are open to the public that people can. We
do a couple fundraisers during the year with One More Time, Alzheimer's Association, all that great stuff.
We had One More Time.
She's my favorite.
Yeah, she's great.
Yep.
She's fantastic.
I actually wrote her very first check.
Really?
Yep.
And she brought that up, actually, that she received a check and was like, I guess I better
make this real.
I guess I better create a bank.
That was me.
Oh, that's so fun. Full circle here. So that's amazing. So Jennifer, thank you for what you do. All of us at some point, if we are blessed enough to live long enough, we'll deal with someone who is elderly, who's a family member, a friend, or ourselves. We'll get to that point where we need that. And so I so appreciate that. My family went through it kind of for the first time with my grandfather a couple years back. And I already did have like an appreciation for assisted living and things like that. But that just made it, really hit it home for me once I went through it.
I think too, because we get to take that caregiver role off of the family. The family it's exhausting for families. And when they are able to kind of release that a little bit and just be able to be the family member, be the wife, the granddaughter, not having to care for them and let us do that, takes a huge load off. And then you can enjoy your time with them. Yeah. And that's important too.
Yep, absolutely. 100%. Well, thank you so much for what you do. And we will make sure we're following and sharing you at the EnVision Center.
Thank you. Thanks for having me. It was fun.
Thanks for listening to today's episode. For more information, you can go to crecidaho.com. Please like, share, and subscribe. We'll see you again soon.